Okay, thank you, Nuria. Good afternoon, everyone. Thank you for being here to this graduation day of the 10th edition of the Hell Barcelona. As Nuria mentioned before, this is not only the closing of the edition of this last month, but it's also a moment not to look back at what the program has been and has become over the last 10 editions. We are very lucky today. We have Jorge Juan Fernandez that later will explain how this was created in 2013, because there was not the vision to bring this methodology and to create this program. But after this 10th edition, I think that we have achieved a lot of objectives, connecting hospitals, professionals, entrepreneurs, and we will try to go further to this journey. I will start just explaining something that most of you already know. As you know, this is the learning process of this program with the different phases. And there is a moment in when the team, the people meet each other. There is then these 2 weeks when through a clinical immersion, you better know the clinical context, you meet the professionals, and then you go to identify the needs that together with the clinicians you find. After that, the moment in when you are filtering these needs, and finally, once you have selected the best solution, you develop the product, the idea, the prototype, and finally a business model. We always say that what makes the health different than other programs is that you don't start with a product or a technology, but you start with a problem and then you find the solution. And this is something that we try to teach to the different people that is in our ecosystem, that those innovations that we create, the best we can is trying to find and to direct these solutions to the really needs that the healthcare system has. So I think that this is a clear example of what we are trying to do in the global ecosystem. As you can see here, this is a program with a lot of great experts that working and coming from different areas. They give this this learning that we need for the program in different areas: entrepreneurship, clinical innovation, regulation, legal strategy, business development, investment, technology, and also market access. And for sure, the crucial key paper and key role of the helping teams, the mentors, that help the people and the fellows that have been participating in this edition to make more robust and more efficient the innovation projects that you already developed. Another important evolution of the program is when we decided to make this program as a part-time hybrid format, because this allowed us not only to make it easier and faster for the different involvement of the people, but also making this program easier for those professionals that want to participate in it. So as you will see later, with the evolution of this program along the last years, you will see that we have achieved more and a higher diversity of the different profiles that have been participating in the program. This is the global amount of hours of the program. There are 200 hours divided in these 3 main blocks, the clinical immersion, then the mentoring, and also the lessons. This is just a brief overview. And as I said before, the most distinctive element of the D-Health program is the clinical immersion. When the fellows, you enter the hospitals, you collaborate with the clinicians, you observe the day-to-day problems and clinical activity that they have in the hospitals, and also not only with the healthcare professionals, but also with patients and the care teams. I think that this makes totally different this program in comparison with others. In this last edition, these are the 6 hospitals that have been participating in the program, covering different areas. In the case of Hospital da Bellvitge, it was maxillofacial, Hospital Clínic Thoracic Surgery, Hospital del Mar Neurology, Sant Joan de Déu Psychiatric, Sant Pau Sleep Disorders Unit, and Hospital Trueta de Girona Pneumology. And we have seen how in these editions after this hard work that you have been doing within the hospitals, but also at home, with the mentors, you have identified these 458 needs. Finally, you have been 23 participants in the different 6 teams, and finally, as we will see later, 6 great projects have been developed, and we will have the chance to learn a bit more about them a bit later. I would also to highlight the support of these institutions. Without them, it would not have been possible. Not only the Generalitat de Catalunya, Ajuntament de Barcelona, also el Consell Català de Formació Continuada, but also collaboration of EAT Health, Tech Barcelona, Biocat, and for sure our host partner, Quatre Cases. And now, once I have done and I have gone through the current edition, I would like to also to look through the last 10 editions that have started in 2013. As you will see, this program has evolved significantly. At that moment, the idea was to boost the Catalan ecosystem, and I think that we achieved this objective, not only developing a great talent, talent that came not only from our sector, but also from others, but for sure, as you will see later, accelerating new projects that are trying to solve real needs that we have in our ecosystem. As I said before, in the current edition in 2025, you have identified these 458 needs, but after the 10 editions of the Health Barcelona, more than 8,000 needs have been identified. This is amazing, These are a lot of needs, that have been identified through these clinical immersions along all these editions. And this was the moment when it was created. It started in 2013. Jorge Juan will explain better that moment, But it started like a full-time immersive program inspired by the Stanford Biodesign methodology. In that moment, the people from Biocat, led by Jorge Juan, brought this methodology to Barcelona, and they created this program that after these 10 editions have been consolidated, also grow, and has been adapted during the different moments of this year, not only during the pandemics, but also later when we decided to move to a part-time and a hybrid model. Today, we can see how the top hospitals in Catalonia have participated along this program during these 10 editions, allowing to connect not only the hospitals with great talent and also with a new clinical challenge. You have seen here, most of them located in the metropolitan area of Barcelona, but you will see later how we are trying to go further to other regions in Catalonia, as we started last year with the Trueta in Girona. And also you can see here as how our program has been adapted to a changing world, seeing the new opportunities, the change. We wanted to maintain this program as we thought that this was really important for our ecosystem, but we had to move. And finally, you can see how during the last years we have been able to achieve more teams with more fellows, because this model of hybrid and part-time model allowed the possibility to do it through this way, and as I said before, to include professionals with a higher diversity from considering their origin. This is a general overview of the different hospitals that participated since 2013 till arriving to this last edition, to the hospitals that said before. And as I also mentioned, we decided on the previous edition to this one to include also other hospitals, moreover to the metropolitan area of Barcelona. We started with Hospital Trueta in Girona, but we are having also different discussions and conversations with other hospitals in Catalonia, trying to go more over to this metropolitan region. These are a summary of the clinical areas that we have been focused along these 10 editions. So as you can see here, I think that most of the areas in the clinical sector have been involved in the health program. And as I said also before, the different needs have been really diverse, no? Business solutions, also implementation innovations, also scientific discovery, no? In each case, it was depending, no, on the final needs and the results after being applied the methodology of the biodesign. And if I focus with the talent, we can see here, no, how this program has also contributed to the creation the creation of the teach, you know, and the development of new talent. No, the total amount of participants along these 10 editions have been this 129 people. With a very high diversity in terms of gender, no? More than a 55% of female participants, and 39 of this total amount of participants, they came from international on other countries, moreover to Catalonia, and a total of 36 teams have been created along these editions. So for us, it's also important, as I said before, not only to be involved with the hospitals, also not to develop new talent with new skills, no? And it's also very happy for us to see how the different participants, after being involved and participating in this program, most of them remain, no, engaged to our sector in health innovation, healthcare transformation, health management, digital projects. Others, no, started to assume, no, new roles in their companies or in their sectors. So our idea from the very beginning was not only to, as I said, to upgrade the skills of the people that were participating in this program, but also to attract people from other sectors to the healthcare ecosystem. And as you can see here, no, how we have also been able, no, to allow, no, the participants to achieve new competences and also to improve their professional situation. And finally, last but not least, to talk about the projects, no? Because this program has also contributed to the creation and development of innovation projects and new startups. These are some of the most significant projects that have continued their journey after the program. In this slide, you can see those that have been able to attract funding or reaching the market. Altogether in the Health Barcelona, they have raised around 15 million euros, no, with their products and their companies. Sorry, I saw here it was 15, but it was more than 17 million euros. And also other examples, no, that they are developing their products with their companies, no, and they are trying to reach the market with great initiatives. And few of them have also participated in other accelerator programs that we have in Biocat, right, to help them to validate their business models and to arrive finally, as I said before, to the market and to the system. I would like to highlight these two examples of successful projects developed through the health program, Mubut, that was developed. They developed a medical device to support people with chronic constipation. As you see here, now they have 8 employees. They raised nearly 8 million euros. They arrived to more than 2,000 patients that have been, that they have used this technology, and the product is already on market. And another great example as HICAP. They developed a device to assist the recovery of patients after invasive mechanical ventilation. They already have 10 employees. They raised more than 3 million and a half euros, and their product is on market through clinical trials, and they are arriving through these clinical trials to the first patients. So is a great overview, no, of what we achieve after these editions, but we continue. Our idea was from the very beginning. I took no this new phase of the health leading Biocat with my team, but the idea is to maintain the health, no, because at the end. The health turns these clinical observations into actionable innovation projects. So we look ahead. The ambition is to continue expanding the impact of the health through the ecosystem, and as I said before, moreover than the Barcelona metropolitan area. We are now in conversations with possible future hospitals. The idea is to go through this expansion and also to create and consolidate an alumni network, no, to make better this, no, this connection after you participate in this program. And the only thing that we can say at that moment is that we are just recruiting the new fellows that they will participate in this new edition. The new edition will start in September 2026. At the end, with the goal of empowering these next generations and also to face the next and the new challenge and the future challenge that we have as a sector. So I finish here just thanking all the participants of this program. You made a great job. I would like also not to thank the people that is attending this event today, and just that we continue because the show must go on. So today, let's see what you present, and thank you and congrats for this great job.